Thank you so much, and thank you so much for having me today. I hope everyone can see my slides okay. Just give me a shout if you can't. I'm very mindful of time, so just to preface this by saying this is a bit of a snapshot of a section of a broader project. I will maybe skim some things, but I'm happy to come back to them in the questions or answer emails later on if something comes to you later on, so do feel free to email me. So yes, like I say, this is reporting some fairly early results of a survey we've done as part of a broader project on children's housing, which is a long-standing interest of mine. So firstly, just to think about why we're interested or so interested in children's housing. From the housing literature perspective, there's relatively little on children compared to adults. And from the child wellbeing, particularly, but also to an extent child health literature, there's relatively fewer bits on housing. And this is partly because there's less survey data on children, although obviously there's administrative data, which is a huge asset. And the emphasis at the moment is on housing as a commodity, as an asset. So we tend to focus on consumers or decision makers, and children not being direct consumers of housing in this model tend to be a little bit neglected. If we think about age groups, we quite often hear about young adults and challenges of getting on the housing ladder, but we don't necessarily hear as much about children. So this is a bit of an oversight, what we would argue. And this is also sometimes due to assumptions that children are shielded from housing and related concerns. So obviously parents do often try and protect their children from issues around housing or income or poverty, but children are very astute and they pick up on these things. And this was established by Tess Ridge in her really important work on social exclusion, but also was further established by some work by the Children and Young People's Commissioner for South Australia. So these are some quotes from 9 and 10-year-old children in South Australia. They weren't asked about housing in particular, they were just asked about their lives and what they worry about. And many of them did say, I worry about losing a house, I worry about our rent going up, we've got to move. So children, despite the best intentions of their parents and carers, are often very aware, unfortunately, of these challenging situations that they're in. However, we can, to an extent, extrapolate from research on adults. So, for example, we know that damp and cold are bad for respiratory and cardiovascular health. That would be true for children as it is for adults. But it's also important to consider that there are additional ways that housing might influence children. So one big one is indirect impacts via their carers and their household. So, for example, there's research in the US that has showed that things like housing stress can impact on a parent's likelihood of remembering to give their child their inhaler if they have asthma, for example. There's also things around emotional contagion where the stress might pass on. And of course, this can happen between adults, but the dependence of children on their carers means that this is a little bit more intense. There's also indirect impacts via the housing's role as a determinant of determinants. So its impact on things like access to schools and health services, which again matters. These things matter for adults, maybe not schools so much, but this role matters for adults. But for children, again, it's a little bit more extreme, perhaps. So there's mixed evidence around housing instability, for example, and the likelihood of children getting all of their vaccinations in childhood. The importance of school, obviously, it plays a huge role where we have catchment areas, and where these catchment areas have different housing costs. This can impact on what the schools children go to, how close they live to their schools, things like that. And there's also the reality that for many children, they live in multiple homes, they're exposed to multiple different homes where their parents have separated and they spend time across two homes. And this all really builds on like the work of Bronfenbrenner, you know, the idea of the ecology of child development and the spaces that children spend time in being really important for their development, the home, of course, being one of the main ones. And on a practical level, children spend large amounts of time in their home, particularly very young children. And there's a need to take a life course approach. So while I'm talking about children as opposed to adults, it's also really important for us to recognise that the needs of toddlers will be very different to the needs of teenagers, for example, where things like access to public transport might become more important, and the need to maintain some kind of independent life more so than for toddlers. So summarised here very briefly, we tend to think about housing and health across these different characteristics, and that remains true and can shape how we think about housing for children, but we just think about it in a slightly different way, of course being really mindful that all of these things tend to overlap and interact with each other. So with that in mind, we developed a survey building on the Australian housing conditions data set, which I think are on our 4th or 5th version of this year, which has really built on or expanded the data available on housing in Australia, because there's been a big gap since the last official survey of housing. And of course, so while this focuses on Australia, there are very clear parallels with the UK. There's some very significant similarities in terms of cultural and housing models across the two countries and across a lot of the home ownership focused countries. So briefly, what we've done is we've conducted a pilot study building on, as I say, the Australian housing conditions data set, but focusing on South Australia and households where there is at least one school-aged or going to school in the coming year child. Adult respondents were asked about the 2 eldest eligible children. So if they had a child that was no longer in school, was 1920, they weren't considered an eligible child. You asked about the next 2. And that was just to stop the survey from being too long. And as a result, we had responses relating to 840 children. This was conducted using a representative online panel with data collected last year. And in our survey, which was broadly representative in terms of tenure and things like that, just under a third of households included children that lived in another home with another parent or carer, in addition to one covered in the survey. And the majority of homes had 1 or 2 children in them. So we've got responses on both. And very briefly, we asked some questions. And one of the really interesting things the Australian Housing Conditions Dataset does is asks different questions about affordability. So there's the traditional subjective affordability question of, is it, a Likert scale? But there's also a question about how much money you have left over after housing costs, reflecting the fact that housing costs are typically large and typically inflexible. How much do you have left over after paying your housing costs? Do you have enough to meet your essentials, your non-essentials, and your savings? And what I think is really interesting about this is I think there's a bit of a disparity between the answers to these different questions. So over 13% of respondents said they didn't have enough money left over for essentials. Now, to me, that sounds very unaffordable. If you don't have enough money to buy essentials, that to me is very unaffordable. However, only 4.7% said that their housing was very unaffordable using the traditional measure of affordability. Likewise, 63%, nearly 64% didn't have enough money to save. And obviously saving is hugely important to be able to meet any surprise expenditures, any emergency costs. And I think what this potentially shows us is that expectations are being shaped by the housing market. People are very aware that the housing market is a challenge at the moment, it's unaffordable. And so when you ask this use this traditional measure, people are adapting their expectations to an unaffordable housing market. Of course, I can't predict that. That's what I think this shows, and I think that's really interesting. Just briefly, we also asked about security. So you can see that about 50% of people have moved in the last 5 years, a small minority, but a significant minority had moved several times. And several respondents have been at their home for a very short time. Specifically in terms of what this means for children, one of the challenges in existing data is understanding the causes of moves. So quite often in studies of housing and children's health or well-being, there's concern about school moves or residential mobility and school mobility. And it's hard to disentangle whether they are related. Sometimes people move home because they are actively seeking to move to a catchment area for a popular or a highly rated school. Sometimes people are moving because they've been forced to, and the school move is a consequence of that. And that can get lost in some of the existing data. So we asked specifically whether the purpose of a move was to move into a school catchment area. And about a third of respondents who moved reported doing so to move into a particular catchment area. And that reflects, in a way, privilege, that they're able to do that because this can often be more expensive. And it reflects autonomy. Whereas for about a quarter of respondents, the reverse happened. They'd had to move home, and as a result, their child had to move schools. So we're starting to separate these two different elements of moving for children, and that's something we want to look into in more detail. In terms of quality, people were broadly happy with the quality of their home, although we did notice that significant minorities of people who reported their home as excellent condition, did have issues with their home that you would be concerned. So things like electrical problems, termite damage, even amongst people that rated their homes as excellent. But over a quarter of households with children rated their home as in poor or very poor condition, or average condition. So some concern there. As I mentioned, access to services is a concern. Generally, things were fairly good, but worsening as you get to things like public transport, which, like I say, it might be a significant concern for teenagers who want some independence, but also things for activities for youth. I mean, health and welfare services, 15% had not great access. So some concerns there as well. Like I said, just skimming these at the moment. Within these findings, there were some interesting cross-tenure differences. So Australia, like the UK, there is concerns about housing crisis often focuses on the inaccessibility of home ownership, increasing people renting privately, and increasing exposure to housing costs throughout the life course. So you can see here that amongst couples with children, they have been disproportionately affected by this rise in private renting. So a 283% increase in the number of, or the proportion of couples with children who are private renting, and reflecting a significant decrease in the numbers owning outright, and a smaller increase in people owning with a mortgage. So as I say, greater exposure to housing costs for households with children. And within these differences, we're going to see things around cross-study differences in some of the things we talked about. So, for example, you can see that private renters are much less likely to rate their home as in excellent or good condition, more likely to live in poor quality homes, more likely to report not having enough money left over to spend on savings or essentials, more likely to move frequently, less likely to be in their current home for an extended period. Of course, this might reflect some preferences, but it likely reflects the nature of private renting. As in the UK, private renting is more insecure, and over 2/3 of private renters in our sample were on a lease of just 6 to 12 months, so very limited security. Perhaps one of the more novel things in the survey was we asked respondents their perception of their housing's circumstances on their children's or young person's health. And this was really interesting because it picked up some of the things we talked about at the beginning about perceptions of children being somewhat shielded from housing concerns. So about a third, just under a third, thought that their housing was having a positive impact on their child's health. Nearly 2/3 said no impact, and a small but concerning minority said it was having a negative impact on health. And we asked them, why do you say that? And there were some really lovely things about the positive impacts of housing. People talked about their children being able to cycle to school, being able to make friends, being near parks, having their own space. Some slightly alarming things where they felt that there was no impact. Some people were making quite significant sacrifices to protect their children from housing problems. So I don't let housing affect her. I don't eat much, I don't have her, so I can afford when I do. So significant financial strain that is being absorbed there by the parent. Someone else talking about, I try to keep the family happy without telling them all the truth. Sometimes I hide the truth. And some really alarming things as well in the negatives. So things around conditions, noise, financial hardship, having to move their children very far away from their school. So even when the moves happen, and perhaps you would typically change your child's school, people are trying to absorb some of the impact by keeping their child in the school. But this means they've got long commutes, and it's harder for them to see their friends, especially if they don't have access to public transport. And a few people mentioned as well that frequent moves or instability or having to move at all was very difficult where children had some kind of neurodiversity going on. So for autistic children in particular, this was an additional challenge. And unsurprisingly, given what we saw in terms of the variation in conditions and security, parents who are renting privately were much more likely to report their housing having a negative impact on their child's health, and much less likely to report their housing having a positive impact on their child's health. We also asked the parents about the impact of their housing on child health, and they were a bit more likely to report a negative impact. And I've explored this in terms of comparing adult with a child responses, child health, and the condition of the home, but I'm aware that I'm at time, so I'll stop. In terms of limitations, there's obviously some significant ones, with it being a survey, a household survey. We miss people in temporary accommodation or experience homelessness, who will obviously have some of the most extreme experiences. We're not talking to the children themselves, and that is something we'd really, really like to do, and it's something we hope to do next. We're also conducting a temperature survey, so we've had temperature sensors in people's homes, so one in the child's bedroom, one in the family shared area, and we're going to look at that alongside a small survey. But we think that this indicates, as we perhaps know from some other data, but with more detail now, some significant challenges affecting households with children in terms of their homes. It's a bit of a tightrope to walk, where you're talking about this and parents are trying, or carers are trying so hard to shield their children from housing concerns. But to say that children are probably likely aware of what's going on, just because, like I said, they're astute, they're smart, and the potential impact remains regardless. But obviously don't want to distress parents or carers. But the shift to reliance on the private rented sector in Australia, as in the UK, for providing housing at scale for households with children has significant implications. The private renting policies were not designed around this for private renting to play this role. Many places in Australia have only just, for example, banned no fault, or what they call no grounds evictions. Some places still have them. Only Canberra, the Capital Territory, has rent control. So it's important to amend housing policy to address the role that private renting plays, much like Scotland has done. So thank you.